Top 20 General Medical Assistant Interview Questions and Answers. Preparing for a general medical assistant interview requires confidence, strong communication skills, and medical knowledge. These top 20 questions and answers will help you demonstrate professionalism and readiness. 1. Why did you choose to become a medical assistant? I chose to become a medical assistant because I enjoy helping others and contributing to patient care. This role allows me to combine medical knowledge with compassion, communication, and organizational skills. Working closely with doctors and patients gives me fulfillment and purpose. I also appreciate the opportunity to support healthcare professionals and ensure smooth clinic operations. Being part of a medical team allows me to make a real difference in people's lives every day. 2. What are the main responsibilities of a medical assistant? A medical assistant's responsibilities include both administrative and clinical tasks. Administrative duties involve scheduling appointments, updating patient records, billing, and managing insurance forms. Clinical duties include taking vital signs, preparing patients for examinations, assisting physicians, collecting lab samples, and administering medications under supervision. A medical assistant ensures smooth workflow between patients, doctors, and staff, maintaining professionalism, confidentiality, and accuracy in all duties to support efficient and compassionate patient care delivery. 3. How do you handle stressful situations in a medical setting? I stay calm and focused by prioritizing tasks and maintaining clear communication with my team. In high-pressure moments, I take deep breaths, remain organized, and focus on solutions rather than problems. I also rely on teamwork and time management to ensure tasks are completed efficiently. Staying composed helps patients feel reassured, and I always remind myself that professionalism and empathy are essential, even during busy or challenging medical situations. 4. How do you maintain patient confidentiality? Maintaining patient confidentiality is critical. I strictly follow HIPAA regulations and ensure that patient information is only shared with authorized personnel. I never discuss patient details in public areas and keep all records secured. Whether working with electronic or paper files, I make sure they are properly stored and protected. Respecting privacy builds trust and reflects professionalism. Protecting patient information is not just a policy, it's an ethical obligation that I take very seriously every day. 5. What experience do you have with electronic medical records, EMR? I have hands-on experience using EMR systems for updating patient data, recording vital signs, scheduling appointments, and processing insurance claims. I'm comfortable navigating different software platforms and ensuring accurate data entry. EMR systems improve efficiency and reduce errors, so I always double-check information for accuracy. I also understand the importance of security when handling digital patient files. My familiarity with EMR technology helps me support smooth clinical operations and better patient care coordination. 6. How do you prioritize tasks during a busy workday? I prioritize tasks based on urgency and importance. First, I handle time-sensitive responsibilities such as patient preparation or urgent messages. Then, I manage administrative tasks like scheduling or documentation. I also keep a checklist to stay organized and communicate with my team to ensure no tasks are missed. Time management and adaptability are key in healthcare settings, allowing me to maintain quality care even when multiple responsibilities need attention simultaneously. 7. Describe a time you dealt with a difficult patient. Once, a patient became upset due to a long wait time. I remained calm, listened carefully, and acknowledged their frustration. I apologized sincerely, explained the delay, and kept them informed of the situation. My calm and respectful approach helped the patient feel heard and valued. They later thanked me for my understanding. This experience reinforced the importance of empathy, patience, and effective communication when dealing with emotionally challenging situations in a healthcare environment. 8. How do you ensure accuracy when taking vital signs? I follow proper procedures and double-check each reading for accuracy. I use calibrated equipment and ensure the patient is comfortable and positioned correctly. After recording measurements like blood pressure, temperature, pulse, and respiration, I review them before entering data into the patient record. Accuracy is essential for quality care and diagnosis, so I take my time to verify readings and report any abnormal results promptly to the attending healthcare professional. 9. How do you handle a medical emergency? In a medical emergency, I remain calm, alert, and follow established protocols. I quickly assess the situation, call for help, and provide first aid or CPR if trained. Communication with the healthcare team is critical, and I ensure emergency equipment is ready and accessible. My focus stays on patient safety and supporting the medical staff effectively. Remaining composed and following procedures ensures quick, coordinated, and efficient responses during emergencies, helping prevent further harm. 10. What skills make you a strong medical assistant? My key strengths include excellent communication, attention to detail, empathy, and multitasking. I am organized, dependable, and adaptable in fast-paced environments. I'm skilled in clinical tasks like vital sign monitoring and administrative duties such as scheduling and data entry. My ability to remain calm under pressure helps patients feel comfortable. These qualities, combined with a strong work ethic and genuine care for others, make me a reliable and effective medical assistant. 11. How do you handle confidential paperwork? I handle confidential paperwork with strict care and professionalism. I store files in secure locations and never leave patient records unattended. When disposing of documents, I use shredders or approved methods to ensure privacy. I follow all data protection guidelines and only share information with authorized personnel. I understand that mishandling paperwork can lead to serious consequences, so I'm always attentive, organized, and compliant with confidentiality protocols in all administrative responsibilities. 12. How do you work as part of a healthcare team? I believe teamwork is vital in healthcare. I communicate openly, respect colleagues' roles, and support others when needed. Collaboration ensures that patients receive consistent, quality care. I listen actively, share updates, and follow directions from supervisors while contributing my skills to achieve common goals. Teamwork also involves showing empathy, maintaining a positive attitude, and stepping in to assist during busy times. A cooperative approach enhances both workflow and patient satisfaction. 13. How would you deal with a patient who refuses treatment? I would remain calm and respectful, listening carefully to understand the patient's concerns. I'd explain the benefits and potential risks clearly, ensuring they have accurate information. If the patient still refuses, I would document the situation and immediately inform the healthcare provider. It's essential to respect patient autonomy while ensuring they're fully informed. My role is to provide support, empathy, and clear communication, helping the patient make a confident, informed decision. 14. How do you manage time between administrative and clinical duties? Balancing administrative and clinical duties requires organization and flexibility. I plan my day by setting priorities and adjusting as needed based on patient flow. I use checklists and communicate regularly with my team to stay on track. I ensure both areas receive equal attention, accurate paperwork, and compassionate patient care. Time management is essential to maintaining a smooth, efficient workflow, and I continuously refine my methods to stay productive and effective. 15. How do you handle constructive criticism? I welcome constructive criticism as an opportunity to improve. I listen carefully, avoid becoming defensive, and ask questions for clarification if needed. I reflect on the feedback and take specific actions to strengthen my performance. I appreciate when supervisors or coworkers help me identify growth areas, as it demonstrates their investment in my success. Being open-minded to feedback helps me become a more skilled, reliable, and professional medical assistant. 16. What steps do you take to prevent the spread of infection? I strictly follow infection control protocols, including proper hand hygiene, using gloves, sanitizing equipment, and wearing appropriate PPE. I clean and disinfect surfaces regularly and dispose of biohazard materials correctly. I also educate patients about hygiene when necessary. By adhering to these practices, I help protect both patients and staff. Preventing infection is a top priority in healthcare, and I consistently ensure safety standards are maintained in every task I perform. 17. How do you stay updated on medical practices and regulations? I stay current by attending workshops, reading medical journals, and completing continuing education courses. I also follow updates from professional associations and healthcare organizations. Staying informed helps me adapt to new technologies, procedures, and compliance standards. I believe lifelong learning is essential for healthcare professionals. By keeping up with evolving medical knowledge and legal regulations, I ensure my work remains accurate, safe, and aligned with the best practices in patient care. 18. Describe your experience with patient scheduling. I have experience managing appointment systems efficiently using both manual and electronic tools. I schedule, confirm, and reschedule appointments while minimizing conflicts and ensuring optimal clinic flow. I always communicate clearly with patients about preparation requirements and arrival times. If emergencies arise, I adjust the schedule to accommodate urgent cases. Effective scheduling reduces patient wait times and improves satisfaction. My organizational and communication skills ensure a smooth and patient-friendly scheduling process. 19. What would you do if you made a mistake on the job? If I made a mistake, I would take responsibility immediately and report it to my supervisor. Transparency is crucial in healthcare. I would explain the error clearly, assist in correcting it, and learn from the experience to prevent recurrence. I believe in maintaining honesty and integrity at all times. Acknowledging mistakes and addressing them quickly ensures patient safety and builds trust with both colleagues and management in a professional healthcare environment. 20. Why should we hire you as our medical assistant? You should hire me because I'm compassionate, reliable, and dedicated to providing high-quality patient care. I bring strong communication skills, attention to detail, and multitasking abilities. My clinical knowledge, organizational strengths, and positive attitude allow me to adapt to any healthcare environment effectively. I'm passionate about helping patients feel comfortable and ensuring smooth daily operations. I'm eager to contribute to your team and grow within a supportive, patient-centered medical environment. These interview questions and answers will help you confidently prepare for your medical assistant interview. Focus on professionalism, compassion, and clear communication to make a lasting impression.